Hello, my name is Colby Caruana. This is Bio 230, and today is December the 1st, and I will be going over the bones of the skeleton. So right here, we're going to have the nasal bone, and inside the eye, most posterior located, is going to be the sphenoid bone. The lacrimal bone is going to be laterally located to the nasal, and the ethmoid is going to be medially located to the sphenoid bone. This is going to be the zygomatic bone. This is going to be his maxilla, his mandible. This is the frontal bone, and this is going to be the vomer. So this is going to be the posterior portion of the skull, starting with the mandible located right here. The occipital lobe is going to be right here, followed by the parietal lobes bilaterally located at the superior end of the skull, and the temporal bone. So this is going to be the lateral portion of the skull diagram, starting with the ethmoid bone, followed by the frontal bone located here, the lacrimal bone, the mandible, the maxilla. This is going to be the nasal bone. The occipital bone located is going to be right here, followed by the parietal, and the temporal, and the zygomatic bone. So this is going to be the inferior view of the skull, starting with the ethmoid bone, followed by the frontal bone, the occipital bone, the parietal bone. The sphenoid is going to be here, and the temporal is going to be here, bilaterally located. This is going to be the video of the vertebral column, starting with the atlas, which is C1, and the axis, which is C2, followed by the cervical vertebrae, which is going to be the first 7. The coccyx is going to be right there, the very bottom. The lumbar vertebrae are going to be the bottom 5, right above the sacrum, and the thoracic are going to be the middle 12, right below the cervical and above the lumbar. These are going to be the video of the thoracic cage, starting with the manubrium of the sternum and the body of the sternum. These ribs are going to be the true ribs because they all attach directly to the sternum, followed by the false ribs, which do not, only attach to each other, and the floating ribs, which do not attach at all. This is going to be the pectoral girdle and upper limbs, starting with the clavicle, bilaterally located, the humerus, the radius located thumb side in anatomical position, the scapula, and the ulna. These are going to be the bones of the wrist and the hand. Be starting with the metacarpals right here and the phalanges. After that, we are going to move on to the lateral side of the hand, which it is hard to tell, but this is going to be the pisiform, which right below it to the left is going to be the triquetrum. Further left to that is going to be the lunate. All the way to the radial side of the hand, this bone right here is going to be the sphenoid, and right above it is going to be the trapezium, and then to the right of that is going to be the trapezoid. To the right of that is going to be the capitate again, and the hamate. This is a video of the pelvic girdle and the lower limbs, starting with the ilium. Going to the ischium, this is going to be the pubic bone. This is the femur. This is the patella, the tibia, and the fibula. This last piece is going to be the bones of the wrist and foot, and we are going to be starting with the phalanges of the foot, the metatarsals, and then we're going to go the medial cuneiform, intermediate cuneiform, lateral cuneiform, and then we're going to go to the cuboid, the navicular, and the talus, and then the calcaneus is going to be on the heel.